Hey, what's up guys? Victor here, and today we're going to talk about the IT band, more specifically an ITB release and why it's so important for femur lengthening. Alright, so let's start with the basics. What exactly is the iliotibial or IT band? Well, it's a tough fiber strip of connective tissue called fascia. A lot of surgeons use the analogy thin like a piece of paper, but incredibly strong. In fact, some research compares the IT band's tensile strength to some metals, and you could potentially hang a mini car from it and it still won't rupture. The IT band starts up high on your outer hip, connecting your TFL or tensor fascia latae, your glute medius, and your glute max down your outer leg all the way to your knee. It runs down alongside the vastus lateralis or your outer quadriceps muscle and attaches to the Gerdy's tubercle, which is the upper end of your tibia. This is why the outer thigh might feel a little bit firmer and smoother than other parts of your thigh, thus creating that visible contour of muscle that you might see on lean muscular athletes. So now we're going to talk about the function of the IT band. So why do we even have this thing? Well, it has a few different jobs, but its main function is that it acts as a tension band that helps with pelvic and knee stability and some posture control as well. It also helps you to lift your leg to the front and side of your body, supporting your knee during flexion and extension movements. In other words, it helps give you a normal walking gait. Let's go a little bit deeper. Every time you stand on one leg or take a step, your knee is going to want to buckle under your body weight. Just imagine standing on one leg. Your body is off center, creating a force that makes your leg want to bend sideways. The IT band, along with the other abductor muscles of your upper hip, are going to resist this sideward bending. This is why you can walk smoothly without a limp. It's also why you might see some femur patients who have a temporary waddle to their walk as they get used to it. This is also known as a Trendelenburg gait. A compromised IT band could influence this sway in your walk, although it's more likely due to muscle atrophy and weakness of the abductors and hip stabilizer muscles, especially if the patient didn't have a weight-bearing nail during the lengthening process to keep the muscles from becoming dormant. And all of this is on top of the fact that it will just take time to adapt to the new leg length and biomechanics. Now let's talk about how the IT band relates to femur lengthening. When your femur bone is lengthened, the IT band doesn't stretch very well to accommodate this new length. And if it's left alone, it can exert a tremendous amount of force on the knee and hinder full knee extension or cause internal rotation of the leg. And this can lead to various problems such as the famous duck ass deformity that you've probably heard of, where tightness of the hip flexors and the IT band can cause your butt to stick out with an abnormal posture, also causing, a weird walking gait. Now, the best analogy that I have to kind of explain how this all kind of intertwines is think of how Spider-Man's web can wreak havoc on a fast-moving train if it has enough points of contact on the train. It can basically cause it to come to a screeching halt or at least lift it off the tracks, right? Now I want you to think what happens when his web begins to tear and release from the train. The train will remain on its tracks and continue on its way. This is much like how the IT band restricts lengthening of the femur bone until it's released by your limb lengthening surgeon. The good thing is that most experienced limb lengthening surgeons will prophylactically release the IT band during the surgery of the femur bones. This involves carefully cutting the IT band to prevent these complications such as wide legs, and it's also crucial for ensuring a normal walking gait after everything's said and done. The cool thing is that it regenerates very well. When cut at the distal end of the femur, which is right near the knee, it heals during the lengthening process without any defects or gaps in the long run. In fact, in some patients, such as those who are excessively tight or muscular, a release might be needed at the proximal portion of the IT band on your upper thigh as well as the lower distal portion. It's also important to note that some surgeons may refrain from releasing the IT band for smaller amounts of lengthening where they don't feel like it will inhibit the functionality of the limb. I think the threshold has been thrown around and it's roughly between 3 and 5 centimeters on the femur, but in the end, it's up to your surgeon to make that decision. So there you have it, the IT band, a somewhat simple structure that plays a big role in femur lengthening. If you're a former femur lengthening patient, let me know down below in the comments if you got your IT band release, and if so, how fast after lengthening or consolidation did it heal or did you feel more stable? And if you enjoyed the video, if you found it helpful, go ahead and hit that like button. Be sure to subscribe. Until next time, this is Victor from Cyborg for Life, signing out. Peace.